Everyone knows proper hand hygiene is important in the world of healthcare. When the average person pictures a hospital environment, they probably think of nurses and doctors wearing gloves, washing their hands, and using sanitizer. But what the average person new to healthcare may not intuit is just how much mortality results from not following these proper practices. It turns out that at least 80,000 deaths are estimated to occur each year in the US in hospitals because of infections that patients acquired while in the hospital. That is a surprising figure. I'm sure you don't want to contribute to that. Health experts agree many of these hospital-acquired infections, or nosocomial infections, are largely preventable. So to clean your hands properly and reduce the spread of bacteria and other potential pathogens, here's what you need to do. Know when to use an alcohol-based hand rub and when to use soap and water. Clean all surfaces of your hands, including underneath your fingernails and between all your fingers. Avoid touching any sink knobs and handles. And be mindful of any jewelry or watches or wristbands. Let's address each of these points one by one. It is important to clean your hands before and after contacting any patient or their environment, and it is usually best to use an alcohol-based hand rub. The relevant literature is clear enough. Disinfection using an alcohol rub is generally superior to hand washing. A 2009 study by Kampf et al. Found 30 seconds of rubbing with an alcohol disinfectant outperformed soap and water against all target flora. The authors note that even thorough hand washing for several minutes barely made an impact on the skin's resident flora, whereas disinfection was found to be highly effective against lots of bacteria, yeasts, and coated viruses like HBV, HCV, and flu viruses. Their conclusion is that soap and water is only optimal when your hands are visibly dirty. And there are only two exceptions. Number 1, spore-forming bacteria. In the case of spore-forming bacteria, hand washing may be necessary, since bacterial spores are resistant to alcohol. For example, this 2010 paper by Jabbar et al. Found that alcohol is not effective against the infamous Clostridium difficile. For spore-forming bacteria like C. diff, you should still use a disinfectant first, then follow up with soap and water. And number 2, uncoated viruses. Some viruses are enveloped, meaning they have an outer lipid coat that may serve to help avoid detection or help the virus bind to host cells. But sanitizers can effectively disrupt this lipid envelope and kill the virus. But the outer surface of uncoated or naked viruses is just a tough protein exterior called a capsid. Sanitizers won't work so well. That's why soap and water is recommended. The idea that you shouldn't use hand sanitizer for fear that they will dry out or otherwise damage your hands is actually unfounded. This paper by Winnefeld and colleagues found that alcohol rubs dry the skin out less than soap and water washing. And this one, by Loeffler et al., discovered alcohol disinfection resulted in less harm to the skin, evidenced by less transepidermal water loss. Part of the reason for this may simply be that alcohol disinfectants have a thoughtful admixture of moisturizer. And keep in mind, having healthy hands is not merely a cosmetic concern. Hands with eczema are more likely to be colonized by pathogens. So, to use an alcohol rub properly, make sure to rub your fingertips on both hands into the gel. And make sure to get in between your fingers by interlacing them. And spread it evenly over all surfaces of your hands until it is dried. If you are going to use soap and water, keep these tips in mind. You may think that hot water is necessary for killing germs, but there is little evidence to support this claim. Rather, it is the physical, mechanical action of rubbing your hands together that does the work, along with the surfactant effect of the soap. Make sure to rub the soap over all surfaces of your hands. Interlock your fingers to effectively clean underneath your fingernails. don't forget your wrists and outside of your thumbs. The CDC recommends the standard of 20 seconds. Try being mindful the next time you wash your hands, and maybe count the seconds, until you get in the habit of washing your hands long enough to get the job done properly. When you're done, use a towel, your elbows, or even better, your sink may have a foot-operated pedal, in which case, just use that. As a final point, if you really want to optimize your hand hygiene, consider leaving your rings, watches, bracelets, and wristbands at home. And that's it. The best way to combat nosocomial infection is 30 seconds of disinfection with an alcohol-based rub. Or, if there's a chance you are fighting spore-forming bacteria or uncoated viruses, soap and water.